Thank you so much, first and foremost, to the ULF for having me and talking about something that is so important, particularly for myself as a social worker, but also for all of us in this community. We know what a toll the holidays can be on our emotional well-being. So we will, hopefully have a pretty robust conversation today. Hopefully, my slides will only take up about half the time, so we'll have plenty of time for questions and answers at the end. Just to introduce myself briefly, I'm a licensed clinical social worker. I've been born and raised in the Philadelphia area. I've lived here my whole life. I began excuse me, working at Children's Hospital in Philadelphia in 2014 in the Division of Neurology, and I have been there ever since. I was a very lucky social worker who got picked to help start the Leukodystrophy Center of Excellence in 2015 and really began to fall in love with this community and the families that I had the opportunity of meeting along the way. And other areas of neurology that I have covered and some still continue to have experience with include mitochondrial diseases, neuromuscular diseases, multiple sclerosis, or any neuroimmune or neuroinflammatory diseases, as well as our epilepsy program. Okay, so don't be fooled by our very short objective today. We're going to cover a lot of information, but we're all here today to really talk about and address the mental health challenges and strategies for wellness during the holiday season, with a specific focus on the unique experiences of our families that are affected by leukodystrophy. And we're going to do that by understanding these mental health challenges that are faced by families during this time of year and learn some realistic and practical strategies to promoting self-care and mental wellness throughout the holiday season. We'll also talk about resources that are available for support. So first and foremost, and I loved Marla's introduction where she talked about, that if we were having this discussion a few decades ago, we wouldn't be having this discussion. Is probably the reality. Is that mental health, is not something that a few decades ago was really on the table for discussion. But we opened today's discussion with a saying that cannot be the case, that we cannot allow mental health to be a taboo subject, and it can't be off limits. So I encourage all of you to, you'll hear me say multiple times throughout this discussion that we want to create a judgment-free zone when we talk about mental health and mental illness, so that we ourselves, as well as people we love, are comfortable having these very difficult discussions, particularly during this very vulnerable time of year. NAMI, or the National Alliance on Mental Illness, notes that 64% of individuals who live with mental illness feel that around the holidays their symptoms tend to worsen. So we know that this is a very stressful time of year. We also know that how we feel emotionally and psychologically and socially has a direct link with how we can perform in our roles. And these emotional, psychological, and health factors are just as important as our physical health. And this can be highlighted during the holiday season. Mental wellness is truly essential for our overall function, as well as how we function specifically in our roles, whether that's caregiver, mother, daughter, husband, wife, employer, employee, however we are in those roles, how our mental wellness is being taken care of really can help define how we perform and how we cope with challenges. And we know that a variety of mental illnesses and their symptoms can impact our functioning, specifically during the holiday season. So, this is not an inclusive list, but these are, of course, mental health concerns that we can see not just over the holidays, of course, but symptoms and diagnoses that we can see exacerbated throughout the holiday season. You'll notice that not everything on this list would be something diagnostic from the DSM-5 criteria, which also just alludes to the fact that holiday stressors are also very impactful. to our everyday well-being over the holiday season. So we'll talk about some of these. Depression and anxiety, both mental health diagnoses that can be exacerbated during the holiday season. Loneliness or isolation, particularly if we are not able or not really capable of participating in holiday gatherings, or as much gatherings as are perhaps going on, that can really highlight feelings of loneliness and isolation. Seasonal affective disorder or seasonal depression. Personally, I know that with the sun setting earlier, it has an immediate toll on how I feel in the late afternoon. Out of nowhere at 4:30, it's pitch black outside. We know that with this time of year, our bodies are going through changes and our minds like trying to play catch up and making kind of understanding that the days are going to be quite shorter, and that can have a toll on our mental health as well. Social anxiety and social obligations. We know that the obligations certainly go up this time of year with holiday gatherings as well as family gatherings. Holiday trauma. This is a really important one to note, because I think it's important to acknowledge that the holidays are not joyous for everyone. That simply because it's a joyous time of year, we also know that this time of year does not necessarily bring joy to a lot of individuals. So just acknowledging that there can be trauma associated with this time of year as well. Grief, including anticipatory grief, um, particularly with our families who have a loved one with leukodystrophy. Sometimes there's the anticipatory grief of questioning, how a disease will progress by the next holiday, or whether or not the holidays will be ones to commemorate, or whether there will be a medical emergency. Those are all things associated with anticipatory grief that we can experience. Guilt, post traumatic stress, overstimulation, and disrupted routines, particularly for people that have attention deficit disorder or ADHD. These are all that overstimulation and disrupted routines can really be burdensome during this time of year. Financial burdens. I think this goes without saying. The holiday season is a very expensive time of year. When you couple that in with caring for a child with, or having a loved one with a leukodystrophy, we know that caring for someone with a complex medical diagnosis is already extremely expensive and costly. Pressures to maintain traditions, and navigating complex relationships throughout this time of year. I love this graphic. I think I personally use this graphic every holiday season, but our baseline mental health issues do not disappear in the holiday season. I like to think that it likely just strings a string of lights around it and maybe gets a little bit bigger. So it's important to know that there's a huge intersection between mental health and the holiday season. So the holiday expectation, of course, the pressure put on family gatherings. We have family that you may not talk to throughout the year that all gather at the holiday season. There's an expectation for quote unquote perfect celebrations, or quite literally creating joy out of nothing. Stress becomes extremely amplified. There's such an emphasis on that social connection and celebration. And again, if you're not able to participate in that collaboration, then it really highlights the feelings of isolation. And then, of course, the increased financial strain. I know families that, as they're preparing for the holidays, particularly travel, they maybe have to order additional supplies or additional medication, things that are not covered by insurance. So we know that there can be increased medical costs along with the holiday season as well. And we understand as a community that the experience of a family with leukodystrophy is unique and unlike any other experience. Period. End of story. That our community is unlike truly any other community that exists. So we know that our holidays and the holiday time within your families, it's viewed through a different lens, and that people outside of your community, it can be hard for others to relate to. So things as simple as, keeping into consideration maintaining feeding and medication schedules as you're trying to plan holiday events or holiday outings. Accessibility is a huge issue. If you want to go to church service or your synagogue and you want to make sure that, okay, well, do they have a ramp? Is it accessible? Or are people's homes accessible for when you're trying to visit loved ones? All of these things that you're taking into consideration that somebody who's outside of your circle may not necessarily understand. The fatigue, and not just the fatigue of the loved one living with leukodystrophy, but quite frankly, the fatigue of the whole family, particularly the caregivers. The excessive fatigue that we feel at this time of year from overperforming and from over socializing and really just trying to keep the family unit on a specific schedule. The risk of winter illness and infection risk. We know that the winter months can come with a lot of pulmonary issues for our patients that have weakened immune systems, and for patients that have weaker pulmonary systems. So. The whole having to weigh the pros and cons of whether or not that there is a risk out in the community, and whether that then will change your holiday plans. The underlining trauma and grief that we talked about earlier that surrounds the holidays, the caregiver burden that's associated with not just the 24/7 role of being a caregiver to your loved one with leukodystrophy, but also your role as a caregiver to the other members of your family as well. And then always constantly anticipating medical needs and emergencies. Again, all factors that are very unique to the experience of having a loved one live leukodystrophy. Knowing, we actually can't travel that far away from a hospital, or we can't go this far with equipment, or, being able to anticipate what all of those possible risks are and those possible dilemmas that may come up are all part of your unique experience. So we've talked a lot about the stressors, and we want to kind of talk about, okay, well, what do we do, and how do we survive this holiday season? So we want to do that by recognizing and tackling stress around the holidays, and we do that in a few different ways. We try to recognize the signs and symptoms as early as possible. This is something we talk about a lot in my profession. We talk about compassion fatigue, and we talk about the need to really take care of one's mind and take care of yourself. And part of that is because we also know that once we as professionals are burnt out, that we also are not doing as high quality of work either. So we always want to talk about recognizing those signs and symptoms very early, and then intervening very early as well. We're going to talk about using practical self care practices. And relying on a support network, in addition to, or more importantly, creating that support network of people that are, no surprise, supportive to the needs that we have as families affected by leukodystrophies. And then exercising coping strategies that we'll talk about, and guarding and creating boundaries for yourself and your family. So, talking about recognizing the signs, this is really something that causes you to pause and reflect, which is probably one of the most challenging things I've had to learn over my profession, is really taking the time to pause in situations or at periods of time, and really self reflect on how things are affecting me, and what to do about it. So that by far is sometimes the most difficult thing to do. We live in a culture that, we'll talk about this later on, that is very yes oriented. So just kind of training yourself to pause and reflect on the situation can sometimes help welcome in an intervention, um, before there's an issue. So just be mindful of behavioral changes. If you start showing less interest in activities that you typically enjoy, changes in, if you remember in school, your Maslow's hierarchy of needs, any changes in your sleep, your appetite, your basic needs, if you're finding that those are slipping, those are all behavioral change you would want to pay attention to. And then your emotional cues as well, sadness, irritability, anxiety, or hopelessness. And as we mentioned, early intervention is key. So we want to intervene as quickly as possible. And how do we do that? We talk about it. So I warned you I would be a broken record. We want to create a culture that discusses mental health challenges in a completely judgment free zone. And that, particularly when you are gathering with people that are maybe outside of your circle or family members from earlier generations, we know that mental health can be a taboo subject. So you have to do what you can within your family unit and in your home to make mental health discussions part of regular family practice and creating a place where there's free of judgment. Um, Having a support place in having a support system in place and seeking that support quickly. Simon Sinek, I hope I'm saying his name right, is he is a American author and inspirational speaker, but he was on a podcast before, and there's a very popular sound clip that's making its way on social media where he talks about reconnecting with a friend, I believe, over the holiday season. And he was shocked to learn that she was, in fact, struggling with something. And he said to her, I never knew you were struggling. You never told me. You never reached out. And she said, of course I did. And he looked back at his phone and he saw text messages like, do you want to grab lunch? Hey, you want to come over? And his argument to her was, how was I supposed to know? How was I supposed to know that these invitations were actually cries for help and not different from any of the other invitations? So she goes on to share with him that she read an article once that says that humans need 8 minutes of connection in order to feel a lighter burden. And that's all it takes, is that 8 minutes of one-on-one human connection to start the process of feeling some relief. So they created a system between the two of them that they text, "Hey, do you have 8 minutes?" as a way to tell each other, "Hey, this is a time when I actually need you." And I love that because it's almost like creating a code word, or having a secret message to someone saying, "Hey, this is a time when I really do need you. Do you have time to be able to be there for me?" And this is particularly important all year long, but at the holidays, because we are inundated with communication. We are inundated with emails and text messages and phone calls and celebrations, and it can be very easy to miss. So, setting up something along those lines where you have somebody in your network that is aware that this may be a challenging time of year for you and that is ready for you when you need that support. This can also look like increasing therapy. If you are regularly in talk therapy, as a social worker, I think the entire planet needs to be in therapy. So I'll always promote it. But this time of year is perhaps a time when you check in with your therapist more frequently. If you feel as though that would be a helpful outlet, scheduled check ins or family meetings, it's a busy time of year. So it's okay if it's not part of your normal routine to have family meetings or to have check-ins with your partners, but maybe during this chaotic month or few months, it's actually going to help with the organization of schedules and the just full transparency of what everybody has on their plate. And more self-care, which we're going to talk about in just one second. I have I'm alone on an island with this notion, but when we talk about self-care, I sometimes love and hate that phrase all at the same time. Meaning mainly because when we talk about taking care of ourselves, I hope that the individuals I speak to, we can normalize it. We can normalize it. We don't glorify it or make it this luxurious type, unattainable ability to care for oneself that we feel like is like a gift or a reward. So when we say the term self-care, I want to make it as simplistic as possible and not, you know, provide any type of messaging that this is like a glorified practice that you need to earn or something that is special, because we all need to take care of ourselves. We all need to take care of ourselves in order to survive and thrive. So when I talk about self care, I always do like to just mention, like, do not put a lot of what we're going to talk about next, on a pedestal or in any type of like reward system for yourself, because these are all things that we need and deserve as human beings. So these are ideas just to take better care of yourself over the holidays. It's can seem like an overwhelming list, but we'll go through it and kind of see how simplistic we can make some of these. So schedule rest. It's okay to schedule yourself a bedtime, to schedule naps if you need to. That is perfectly okay. And to schedule also physical and emotional breaks. We'll talk about this later, but if you're able to kind of plan out and see what your December looks like, you may see pockets of time where there aren't things scheduled that you may want to protect as a, hey, you know what, we don't have anything going on this one Saturday. Let's keep it that way, because I'm going to need a social break and I'm going to need a physical break from the holidays. Your sleep hygiene, just being mindful that you start noticing difference in your sleep hygiene to try to get that moved back on track. Movement in general, science tells us that movement is one of the best ways to combat anxiety, which oftentimes when we're feeling anxious or we're feeling anxiety, we sometimes want to retreat and be still. And science actually tells us that movement is very helpful for anxiety. So any type of movement, even if it's simple as I'm just going to take a walk to the end of the block and back, any movement is really such very, very beneficial for us. Nutrition, we're obviously in the season of a lot of treats and festivities. Just be mindful and try to balance where you can. Stay hydrated. Something as simple as just drinking water. I give you permission to splurge on an emotional support water bottle for the holiday season. Keep it with you, take it with you when you hit the Target store, and just kind of like refueling your body with water is also gonna make a difference. Breathing, again, something that sounds very, very simple. I remember when I was in my undergrad program was when a lot of the emphasis, a very long time ago, when a lot of the emphasis on mindfulness and breathing techniques and meditations were really coming to fruition. I am a very kind of like A type personality and a little bit more concrete. So it was harder for me to grasp that this was an intervention that was efficacious. But silly, little did I know all of the mental benefits to having some form of meditation and breathing in your life. So even if it's a something, even if you don't find a great deal of benefit from more mindfulness techniques like meditation, doing something as simple as just a breathing exercise can sometimes, decrease that, decrease kind of our blood pressure and kind of stabilize things so that we can feel just a little bit of relief. If you have an Apple Watch, there's a breathing app like already installed that's 90 seconds long. Or if you want to do an exercise like 4-7-8 breathing, that is a very popular one where you breathe in for 4 seconds, you hold for 7 seconds, and you breathe out for 8 seconds. And doing that for a couple times. Again, the other thing that I really love about these short little breathing exercises is that it gives you the ability to pause. So when you're focusing on your breath, you're really not doing anything else. It kind of forces you to stop multitasking and to just be still and to pause. And that can sometimes point you where you go from there. So that's one of the reasons why I think even small breathing exercises can be very helpful. and taking social breaks whenever needed. I interpret this as both social breaks. With any of my fellow introverts out there, you are allowed to spend time with a book, and you are allowed to spend time not exhausting your social skills. And this can also mean like taking a break from social media too. Social media can be helpful, but if it's not helpful, we're allowed to put it down. So we'll talk a little bit about building a supportive network. um, the most important thing about our network, particularly at this time of year, is making our circle of people people that we know and trust. We know that at the holiday season, we are going to see and hear from and meet and spend time with a lot of people who we are not spending time with throughout the year. So I want to kind of give you permission to allow the people that are helpful and that understand your experience into your circle, and the people that don't, they don't have to be a part of your circle. So we understand in this community that having loved ones with leukodystrophy provides you with a very unique experience, and you're allowed to protect that experience and really have the people in your support network, people that really understand your story. Again, this goes back to engaging in those conversations completely free of judgment, having a network of people that you can call up and say, hey, I'm having a really frustrating day. I need some time to kind of be able to talk about it, and there be no judgment received on the other end. Sharing responsibilities, the holidays is a very busy time. So it's okay, particularly if you're in the caregiver role, to share some of those responsibilities with other people and delegate some of those responsibilities. Organize holiday activities collaboratively, even if you're the planner or the caregiver of the household. It's okay to share some of that responsibility with others, and actually make more family decisions as to what to do over the holidays, and be creative in expanding your network. I'll share with you what I mean by that. I was in a support group a few years ago, and this mother had shared this story with me that I thought was very unique and creative, in that she created tiny business cards that had her child had a very rare disease, and it was just a few bullet points about her child. And you may think, like, creating business cards, that sounds like a lot of work. However, beings that she was able to carry them around for years, so do this like one task and carry them around for years, and hand them out to everyone from the Santa Claus at the mall or the substitute bus driver for the day, in order to just provide them with a glimpse of education on her child's diagnosis, so that she was not having that discussion and reteaching people as often as she then needed to be. So again, very creative. If something like that does not sound fun, then by all means, don't do it. But do something that you think will be creative in expanding your network, and in a way that it doesn't feel like a chore. This also around the holidays can feel like, or not even during the holidays, this is a suggestion we give to a lot of our families in our leukodystrophy community, is to designate like a very trusted loved one that can answer questions, that you can kind of point to, particularly when families want to quote unquote, do stuff for you or asks how they can help. You can have a family member kind of designate and say, hey, thank you so much for reaching out. I'm actually going to connect you with my sister. She runs an Amazon wish list or something, so that that person is feeling like they can contribute, but then that responsibility of having to accept that help, which can also be exhausting, kind of gets put onto can be shared with another person. So again, be creative in how we share and expand our network. It's as long as it's not a chore, we can certainly be creative in that. And some coping strategies. So some of this may seem kind of silly simple. Sorry, I'm just moving my thing so I can see everything. Setting realistic expectations. So perfection is not the goal. Focus on truly what matters. When you're having a family gathering, remember that it does not need to be perfect. The plan and expect for flexibility to accommodate everybody's needs. It's okay to adjust to new realities. Christmas 2024 may not look like Christmas 2023 or 2022, and that is okay. You and your family can adjust to what the new expectations and new reality may be for you and your family, and you can still find plenty of joy in those moments. And don't worry, we're going to be talking about boundary setting in the next slide. Um, Next, to find joy, even simple traditions can bring about a great deal of joy. And keeping traditions even inclusive to ensure that people of all different abilities can participate. They don't have to be elaborate. You can still find very joy-filled moments in traditions that you keep extremely simple. Keep a holiday gratitude journal is another idea. I think journaling takes a lot of effort, and asking people to journal is a lot of work. So when we can define it or kind of compact it to a specific event or time of year, I feel like it makes it a little bit more attainable. So it's December 1st. It would be a great day to start a gratitude journal if you wanted to. Something that's really as simple as writing 1 to 2 words per day, just something to kind of reframe focus and to highlight kind of what you were grateful for that day. Could be certainly something, an activity that you do throughout the holidays that kind of resets or reframes your mind. And practice self-compassion. Give yourself grace. We talked about like perfection not being the goal, and that also starts with how you take care with how you treat yourself too. So just practice self-compassion and give yourself grace. Planning for difficult times, and this includes like knowing potential triggers, places, events, and most importantly people, and strategize your coping around those things. I give you permission that if your, great Aunt Sally, thrice removed, that has really challenging questions about your loved one with leukodystrophy that are not helpful and cause stress, like I give you permission not to like take that phone call, or you're allowed to give that phone call to somebody else. Like you are allowed to know and recognize what your triggers of stress are around the holidays and to set firmer boundaries around those. Um, and then it's okay to also have a safe place, and this goes for all members of the family. It's okay to have a calm corner or times when it's okay to retreat to be by yourself, so that you can also have time to just kind of like regroup and refuel, because we know how exhausting these times can be. And now, talking my favorite thing, setting boundaries. So this is extremely important over the holidays because we'll talk about the yes reflex, but the first thing I usually like to suggest is that even if you are not a planner, even if you don't keep an electronic planner or a handwritten planner or a calendar, I suggest just trying one out for the month of December, because you'll be surprised how many yeses you've given in the last couple months that maybe you don't even realize. So that when you actually see everything down on paper, you may see, oh my goodness, we have stuff planned for every single weekend. We have to start saying no to some things, or at least when new invitations or new expectations come in, you say, actually, we already know we are at our max. We can't take on any more commitments, but thank you. Having that out on paper is going to make that conversation a whole lot easier. Give yourself permission to set boundaries. Making boundaries is so uncomfortable because we like to people please, and we like to, particularly around the holidays. And we talked about the expectation to, see your great Aunt Sally thrice removed and all of these other family members that you don't get to see very often. So give yourself permission to just at least acknowledge what that boundary is and what is going to be helpful or hurtful during the holiday season. Try to stop the yes reflex. I think there's a lot of strategies to do this. As someone who also, I struggle with saying yes a lot, particularly in my personal life. One of the things that I have tried to implement is maybe not saying yes right away. So if you can get into a habit of maybe not the automatic yes, but saying like, thank you so much for the invitation. I'll get back to you. Let me just check my calendar. Just putting a little bit of distance in between the question and what your response will maybe be enough time for you to be able to figure out, okay, is this actually something we can do, or not? So just again, giving a little bit of distance in that. And Brene Brown says to rehearse, and rehearse, making mantra, and keeping a journal. This is all suggestions from Brene Brown. Um, and I love her idea of rehearsing because, again, we talk about there being discomfort with setting boundaries and sometimes saying no. So it's okay to practice, saying like, okay, thank you so much for thinking of us, but actually we aren't able to do X, Y, or Z, or we're not going to be able to participate in this or that. And it's okay to actually rehearse that, because doing hard things is hard. So you can make them easier by just making it repetitious and by actually practicing what to say. The other suggestion that I've given to parents, particularly when they have a newer diagnosis, is to sit down maybe once or twice and craft an email or craft kind of a generic response that you can keep on your desktop, like post it or in a Word document, so that when people are reaching out to you, you have kind of a you don't have to kind of be re-traumatized by responding to a lot of the invitations or a lot of the email requests that you may get. And you can have kind of something that you've written that is heartfelt, but something that you can use multiple times. That's okay too. So give yourself permission to kind of be creative with how you are responding to things. She also says make a mantra. Make a mantra. I love this. This is one that I'm definitely choosing this year. Choose discomfort over resentment. What she means by that is, choosing the discomfort of saying no over the resentment of not saying no and then being resentful the whole time. She even recommends keeping a resentment journal, which is interesting, and I wish Brene Brown was here to talk about that more. But I think what she leads to is, really kind of just acknowledging the things that we have done that have maybe not brought us joy, so that we actually know how to set those boundaries in the future. And just be transparent with your limits. Again, since we were talking about our inner circle and sending and creating our support network, people within our network of supporters are going to be mindful and empathetic with our limits. And when you are transparent with your limits, you express a level of vulnerability that creates a culture of more acceptance. So it is okay to be transparent with what you can and cannot do. And last but not least, we of course do not want to forget to enjoy the holidays as well. Engage with your community to the best that you can. If there are activities going on in your local community that interest you and your family, make it a point to participate in them if that is something that you want to do. Be sure that holiday activities can be inclusive, even something as simple as watching a holiday movie together, where people with all different types of abilities or disabilities can participate. That starts to create brand new, really engaging traditions. Asking the leukodystrophy community how others have dealt with similar challenges. I recently had a family who it was very important for them for their child to participate in a specific religious ritual, and there were a lot of barriers, and she turned to the experts, which are our leukodystrophy families, as to how other families had dealt with similar situations, and the child was able to participate in the activity, and it was so meaningful to them. But truly, the leukodystrophy community is the experts that we need to lean on when we are experiencing these barriers. So we say, hey, you know what? I really want to participate in something like this, have you guys found something that is accessible, or how do you do this in the community? And you'd be surprised at how much really incredible feedback you can get back. We talked about creating new holiday traditions, even if they're simple. Rotating responsibilities among family members. I say this to all of my caregivers out there. It is okay to delegate some of your responsibilities to other people. Embracing gratitude. It has been found that when we find ourselves in moments of gratitude, the health benefits and the mental benefits are just so abundant. So finding a way to embrace the gratitude around the holidays will really be beneficial. And being aware of the human instinct to compare your experience to others. As Teddy Roosevelt said, comparison is the thief of joy. So if that means staying off of social media, or just limiting how much of that comparison you may be prone to, we know that it's human nature sometimes to play the comparison game, and we just want to not expose ourselves to that opportunity. So there's a lot of resources available for dealing with mental health over the holidays. Both of these graphics are from SAMHSA, the Substance Abuse Mental Health. I'm saying, I'm forgetting the last two words. SAMHSA is a fantastic resource. The first graphic are just coping tips getting through the holiday season. And the last one, as you can see, it's just a graphic. But if you go to the SAMHSA website, they have an entire section that is filled with holiday toolkits to kind of work your way through different holiday stress for both yourself and your loved ones. So mental health hotlines and services are extremely helpful this time of year. There's a lot of information online through SAMHSA, NAMI, and other organizations. Meditation and breathing exercises. Like I said, the Apple Watch has two different breathing exercises, or maybe even more than that. That's like 90 seconds or 3 minutes. And then there's apps also that you can download to just kind of check in on yourself and to participate in some of those exercises. Reach out to the leukodystrophy community when you have specific questions about things like respite counseling and information, and also utilize online support groups or forums just like this with organizations like the ULF, because again, like, we want people in our circle and in our support network that understand our journey. And then, of course, seek professional help when appropriate. First and foremost, whenever you feel like there is a mental health emergency going on with either yourself or someone in your family, utilize your local mobile crisis, utilize 988 or 911. For those of you who don't know, 988 is the now like national suicide hotline for about the last 2 years. So when you dial or text 988, you can talk with a crisis counselor immediately. Your engagement with professionals can be proactive, not just when there is an acute crisis or an emergency. So, like I said, like, if you are already in talk therapy, even if it's just increasing that during the time of the holidays, those are all really okay things to do to just protect yourself. Know and discuss specific signs. For example, if you're noticing in yourself persistent depression, or you're really having problems functioning, those are all times when you want to seek professional help. Understand the different types of mental health professionals. There's everything from therapists to psychologists to psychiatrists to licensed clinical social workers like myself. Understand the different roles that they play. If you need help, even someone like your primary care doctor can point you in the right direction. So reach out to someone reach out to a professional in your life in order to get linked up with the right people. And I always tell people, when you are looking for a mental health provider, try to utilize individuals who understand issues that are specific to your experience, things like grief, chronic illness, and family dynamics. It always breaks my heart when families engage in mental health practices and services with individuals where they feel as though they're doing mostly a lot of educating and providing a lot of information on leukodystrophies. And again, we don't need them to be experts in leukodystrophies, but we do need them to be experts in how you navigate a complex medical illness like leukodystrophies. So finding that right fit is always very, very important. So I think I went much longer than I thought, but just to summarize, We know that mental health challenges by families affected in this community are very profound and they're very multifaceted. We also know that this can be amplified at the holiday season. It's really important for you to just acknowledge the emotional toll that the holiday takes on us, to really work on our healthy coping strategies and to seek support when needed, even if that's, professional counseling, support groups, or our own leukodystrophy community. Addressing mental health needs is really so important to managing life with leukodystrophies. It goes back to the analogy that a lot of mental health professionals use of like putting the oxygen mask on yourself on an airplane before putting it on somebody else. Really, just ensuring the way that you can care for yourself as a caregiver and your loved ones, especially around this particular time of year, which can be very anxiety and stressful. I just want to thank everybody so much for your time today. As we mentioned, we are officially in December, so I know that it's a very busy time of year for everyone. So I'm so thankful, and I'm happy to answer any questions that you have. But truly, thank you all for being here.